It's absolutely essential to take a pause and to consider the importance of the understanding that the context in which US journalism is operating today, this very minute, is a critical context. A lot of the rights, a lot of the freedoms, a lot of the systems that were in place to protect, to care, and also to finance a lot of the work that media does in the United States are in flux. And this is one of the reasons why we decided to name this the survey or this report From Crisis to Care. We want to be able to be the most optimistic, the most positive, and as Joe mentioned it, the most action guided and the most action forward in presenting the results, and also further on the project solutions that ModernNet is going to offer to journalists across the United States. One of the main takeaways that the survey gave us, besides the fact of being bold enough to launch a national survey and ask journalists of all ages, in all contexts, and across 26 states in the United States, how are you feeling? Tell us a bit about you, which we thought in the beginning was a simple question, and then we realized it wasn't easy at all. The main takeaway is that journalists in this country envision a future where mental health care, support, and community-based care is not just for the few. What journalists want in the United States is care as a professional space, care as a professional response to the way in which we do our work, and also the way in which we relate to one another in an accessible way, in a grounded way, in a trauma-informed way, and also definitely embedded in the fabric of journalism itself, from commissioning stories to the way in which we communicate what we do. Supporting journalists requires systemic solutions, and definitely and for sure, healthier newsroom cultures, leadership that is supportive. We will talk about the role of editors, the integral part of editors, as well as owners and publishers, in making sure that care is not only present, but also funded and also provided for. And definitely, we will not be able to build and we will not be able to provide care if there is not a community that is also not only feeling seen, but also receptive to the changes in culture, and also receptive to the necessities that we will have in recognizing in each other vulnerability, but also a lot of courage.